Good afternoon, everyone, and welcome, as always, to our press conference. This is for Friday, the 12th of March. We are live on YouTube. The link will be available later for those that want to watch it back. We've got on our panel today, Lucy Whiteman, our Director of Public Health, Simon Weldon, Group CEO of Northampton General Hospital and Kettering General Hospital, Anna Dorothy, who's Deputy Director of Northamptonshire COVID Vaccination Programme, and Assistant Chief Constable Simon Blatchley from Northamptonshire Police. We're also joined by Paul Andrews from the School Cellar NCC, Councillor Tom Beattie, who's the leader of Corby Borough Council, and we will probably be joined by Tracy Dempster, who is Assistant Director of Ambulatory Diabetes and Therapy Services. And they will appear in that order to do their introductions to their items. Then we will move to the submitted questions. And then if there's time, we may take other questions. Having said that, we do have a lot of questions today. So if we don't get to any extra questions, I do apologise, but we're always available to answer questions outside of the meetings. So I will come swiftly to Lucy Whiteman, our Director of Public Health, to give us an update on the figures this week. Good afternoon, Lucy.
Good afternoon, Councillor Morrison, and thank you again for joining us, everybody. So as always, we've got the surveillance report on the NCC website. So please, obviously, do go back and have a look at some of the detail, because I'll just be giving a high-level summary. As Councillor Morris said, we've got a lot of questions that are coming this week. But the surveillance report being published today covers the week up to the 7th of March. Obviously, we continue to be in a national lockdown, and therefore those restrictions continue to apply across the county. We are seeing that work, and we continue to make progress in all of our boroughs and districts, with 548 positive cases in the week up to the 7th of March. But we are still seeing, as we've talked about before, that where transmission happens, it is happening within and between households. So we do clearly need people to continue to adhere to the rules and use these last couple of weeks before we start to make significant steps out of lockdown to get to as positive a position in the county as possible. We clearly still do have hotspot areas, and we cannot afford to be complacent. Obviously, part of the challenge is that we've got a lot of people who do continue to need to attend work because they are unable to work from home. That age group that most affected at this point in time continues to be 30 to 39-year-olds for males and females. But obviously the good news is we've got further sites coming online for lateral flow device testing for those that do need to attend work. And again, we'd encourage employers to be taking up the national programme that offers that for larger employers as well. Those people that can't do it within their organisation, please do use those community services that we've been setting up for you. So moving forward, if we just go to that first page with the data, as we always do, it just shows us the progress that's been being made. So, you know, we are still seeing a downward trend. That is really positive. It is slightly smaller this week, but obviously as our numbers get smaller, we would expect to see that proportionate reduction reduce slightly. There clearly is still room for improvement. And as I said, we want to be in as positive a position as possible by the end of the month, so that we can obviously start to move through the next steps on the roadmap out of lockdown without, you know, having concerns about underlying communication rates in the community. If we get down to the next slide, it just starts to give us a bit of a picture about where we've still got areas of concern. Clearly, Corby still on that top 20 chief medical officers watch list, now down to number 14 on that list. But you know, that is a significant amount of progress in a very short period of time. And I can't, you know, applaud the efforts of all of the Corby residents, the Corby environmental health officers, the police, the wardens, everybody who's contributed to that really rapid progress over the last couple of weeks. Yes, we've still got a long way to go. But as I said, we cannot take away from particularly the residents the fact that those people that are doing what they need to be doing and adhering to the rules, it's really making an impact on the community transmission there. Positivity rates are down to 5.5% today, and we're obviously seeing a week-on-week reduction in the number of cases, which is brilliant news. Just got to keep going for the next couple of weeks and get those rates down further. Northampton, again, because of similar issues, high levels of deprivation, high population density, lots of people needing to attend work, still in that kind of area as well. We still are seeing higher rates, but again, we're also seeing that where people are doing what they should be doing, and we're working together as a community, that we're seeing positive outcomes and really good progress. On the next slide, it just gives you those actual numbers for each of those areas, but the beautiful part about that is it's a decrease across the piece. So I said really positive progress, still areas that we need to focus on, but yeah, I can't really congratulate people enough for all of their efforts and just ask them to keep going. If we go down again, beautiful graph that shows all of the reward for the efforts. So as we've talked about before, the lines below the 0 x-axis across the middle shows where we are declining in cases. And you can see in the last sort of week or so, that bar's really grown. That shows that the proportion, and the percentage change from a point of view of COVID numbers is really increasing when we start to look at how our downward trend is growing. Obviously, in the last day or so, that's reduced marginally, but broadly, you can see where the efforts are stepped up, the reward is there. So please do keep going. Next slide, please. Again, really good pictorial illustration of the progress that's been made. You can see all of the boroughs and districts starting to cluster much more around the England and the county average, and that steep decline there in Corby. If we go on to the next page, again, we can start to see that the numbers are smaller. Again, still clustered around that working age group. We are expecting to see, as we've talked about before, an increase in the numbers that are school age related. That is going to be a natural consequence of putting lots of people in settings in close proximity. No matter how secure those settings are, we do recognise that, that there will be an increase in transmission in those age groups. Lateral flow device testing is going to help us identify those that are positive and obviously get them isolated as soon as possible to kind of minimise that impact. So please, as I said, childcare bubbles as well, and pupils that are eligible and teachers as well in those settings, please do utilise those tools. This is the only way that we will keep a grip on the position in Northamptonshire and progress through all of the next gateways to come out of lockdown. Next slide, please. So again, I've talked about the fact that I don't want to have this slide in our pack. Sadly, it's still in there this week, but people, I'm sure, will note that we have had progress. We've seen a decrease in most areas with regard to mortality, but 8 deaths is still too many in this county. And obviously South Northants, that had seen no deaths in the previous week, sadly has seen one as well. So it is a slide, as I said, that we strive to not have to report on at all. We're still some way from that, but we can see that we're making progress, particularly as the case rate in the over 60s continues to decline, very much in line with the fact that vaccination uptake in that age group has been good. But again, I'm sure Anna will be talking about later the fact that there's still room for improvement there as well. So when that call comes for vaccination, please do step up. You're not only protecting yourself, but you're also protecting others as it reduces transmission in communities. So moving on. Again, this is another illustration of the efficacy of the vaccination programme. We're seeing, as I said, that case rate in the over 60s reduced. That translates into a reduced number of beds occupied by COVID positive patients. I'll leave Simon to talk about the detail. We've still got a lot of work to do and lots to catch up on in the acute sector, but this is really good news, and we can really start to now focus on recovery and reset of the services that have been paused. So great progress. We move on. So the next 3 maps, as always, focus on the areas that have seen cases by community in the last 28 days. As people will recognise from the crude numbers and the rates we've covered, they're focused in the north of the county, but obviously we can see as well cases in other areas. And if we go down 2 slides into the percentage change in different communities, again, focusing on those 5 areas where we've seen increases in the rates, that's not a trend we want to see. They aren't specifically geographically clustered. This does demonstrate that we've still got COVID in our communities and we just cannot afford to be complacent. So as those restrictions are relaxed, we do still need to remember that when we're out and about, you need to be maintaining your hand space best practice as well. We can't afford to see more blue on these maps with areas increasing in their case rates. And if we just go down onto that last slide with outbreaks. Good news, again, lateral flow device testing is really helping us obviously identify where we've got asymptomatic cases, and the lion's share of outbreaks absolutely involve people who don't have symptoms. It's actually now rarer and rarer to see people presenting with symptoms. So lateral flow device testing is adding value. People do need to remember though, if you get a negative lateral flow device test, it doesn't mean you don't have COVID. It just means at that point in time, you're not highly infectious. So please, to make sure that we maximize the opportunity provided by these types of tests, one, use them regularly, either through your employer, through the community services, or through the sets that are now offered for school and childcare bubbles. But also remember, just because you've had a test that hasn't come back positive, it doesn't mean you're COVID free. Please maintain your distance. Please use your face masks where appropriate in the settings. And please do obviously maintain hand hygiene. That's going to be key to keeping on top of this as we progress through the release of lockdown. So I'll stop there, Councillor Morris. Thank you.
Thank you very much, as always, Lucy. Some encouraging figures there, but we're still not there. And as you say, hands, face and space, and stay at home when we're still in lockdown. Don't leave your home unless you absolutely have to. So I'm going to come now to Simon Weldon, who we haven't seen on this panel for a while. So welcome, Simon, and you're just going to give us a quick update on the acute hospitals and your key messages that you wish to share with us. Simon, good afternoon.
Good afternoon, everybody. Thanks for joining us today. So as Lucy has just highlighted, we continue to see a decline in the numbers of patients in hospitals who have COVID. And that's really obviously welcome and a tribute to the work that everybody's done in the community to support the progress that we've made. But still, even today, we have 79 patients in hospital beds across our county who've got COVID. 40 in Northampton and 39 in Kettering. So a significant number still of patients who have COVID and are in hospital. And that just for me highlights the need as we continue to progress through the next phases of our roadmap out of lockdown for continued vigilance. In addition, I'd like to take the opportunity just to remind people that our A&E departments are still continuing to be very busy, and please do consider carefully before you come to an A&E department whether you really need to do that. There are alternatives. 111, NHS 111 can continue to provide really useful sources of advice and also treatment destinations for you and your family or your loved ones to make sure that you get the care that you need. Think really carefully would be my message about whether you need to come to a hospital for treatment and care. I want to support the message around hands, face and space. Hospitals are people places, that's for sure, but that means we need to continue to be vigilant, wear the mask, maintain social distancing, incredibly important messages for us so that we can pivot as we exit lockdown to what I think will be an increasingly important part of next year and where I want to be able to put most of my effort, which is in restoring all of the services that people have had to wait for during this last lockdown, and particularly start to focus on treating and providing good quality elective operations for people that need them. So bear with us, continue to support us for the next few weeks, and hopefully we can start to get back to the services that you need and want in your local hospitals. Thanks very much.
Thank you very much, Simon, as always. I'm coming now to Anna Dorothy, who's the Deputy Director of the COVID vaccination programme. Anna hasn't joined us before, so good afternoon, Anna, and thank you for your time, as always, as I know how valuable it is at the moment. Over to you, Anna.
Thank you, Councillor Morris, and thanks for the opportunity to join today. So first of all, I'd just like to update everybody on our latest vaccination figures and statistics. We're making excellent progress through the cohorts in terms of protecting our population. So we've now given 253,517 doses in total. 239,480 of those are first doses, with 14,037 as second doses. In terms of our over 80 cohort penetration, we've now vaccinated 97.5% of our over 80s. We have vaccinated 100% now of our 75 to 79 age cohorts. 70 to 74s are at 96.1%. Our 65s to 69s are at 87.3%. Our 60s to 64s are at 71%. And then we will be progressing through the cohorts. So those were figures published on the 11th of March. And in terms of other progress and updates, so we're really pleased to have launched our first couple of pharmacy-led vaccination centres, one of those being in Corby and the other in Kingsthorpe. So what's that done is offer further choice and opportunity for members of the public to get their vaccination. So between the practices, between the pharmacies and also the vaccination centre, there's loads of opportunity for people to get their vaccine now. We've also extended, as part of the national programme, the eligibility. So 55 to 59-year-olds are now receiving their letters and being invited in, and have already been taking up those slots and getting booked in. The NHS text alerts service has also been launched and up and running. So our 55 and overs and also unpaid carers are receiving text messages now, inviting them to book a slot, again, either through vaccination centres and the national booking system, or through their local vaccination services. Through general practice and care homes, so we've made some really strong progress through care homes. All of our over 65s in care homes have now been offered the vaccine, and we're almost there with the under 65s as well now. So excellent progress there. We continue to encourage all of our health and care staff to take up the vaccination. The focus remains in line with the JCVI guidance to focus on our frontline health and care staff. So everybody has been offered the vaccine now. They've been offered the opportunity. We're not at the 100% that we would really like to be at the moment. So continue to work with our NHS and social care staff to encourage them, provide them with information and reassurance, and again, opportunities to take up that vaccination. We're starting to roll out second doses now. We are in the second dose wave. So our hospital hubs have gone live and back up and running, again at Northampton General, and also Kettering coming online next week with our second doses. So yes, we continue to work within those eligibility cohorts as they ramp up, and are really pleased with the progress we're making so far. So thank you.
Thank you very much, Anna. Some really good progress there again in the vaccination arena. So great to see that we're doing so well in the county. I'm looking forward to when I get my call up. I shall almost definitely be rushing as quickly as I can to wherever I'm called up to get my vaccination. And I hope everyone who's watching will do the same, because it's important that we are all protected. Thank you, Anna. I'm going to come now to Assistant Chief Constable Simon Blatchley for an update on what's been going on with the police, and I'm sure he's got some interesting information as always. Good afternoon, Simon.
Good afternoon, Councillor. Good afternoon, everyone. Thank you for the invitation this afternoon. We've continued to work in support of our health NHS partners and continue to enforce as we have been throughout the pandemic. It's disappointing that we're still seeing the most common thing we're getting called to is the large gatherings of people, both inside people's houses and outside. And generally, these are coming in from members of the public reporting it to us. Just to give you a couple of examples, on Sunday, we attended the halls of residence at the university, called by the university security team, and we issued 27 tickets to people there, 14 of whom have received £800 fine tickets. Far too many people, no excuse. At this stage of the lockdown, people can clearly understand that that is not the sort of event that should be happening. Equally, we had a house party at Kettering, a birthday party, 18 were found at the house, all were given £800 fines. So, see, we're still enforcing, we're still out there, we are targeting as always on where the public call us or where our partners say we need to be, such as in Corby. I know that there might be some rumours going around that all don't pay the ticket because you want to be chased up. The system is we issue the tickets. You have that certain period to pay. What we have found now, although there's some delay in the court systems, is everybody that subsequently appealed and went to court for the first lockdown was still convicted by the magistrates' court. So everybody absolutely has that right of appeal, but I would encourage people have that conversation with the officer at the time, but please just don't put yourself in that position in the first place. We have to enforce. Just as a policing service, we don't really want to be doing this. We would rather be focusing on other activity, but it is vital to keep people safe that we do so. So we will continue to enforce throughout the lockdown period. Thank you, Councillor.
Thank you very much, Simon, and good to know that our police force are doing a sterling job in keeping us safe and enforcing the rules. Perhaps in a league table of perhaps in number one place across the country, perhaps for enforcement. It would be good to think that was the case. But thank you so much. Right, we'll come to the written questions that have been submitted by the media first. So we've got Northants Live and Tom Hitchener first. Tom, are you there, Tom?
Yes, I am, Councillor Morris. Thank you for the update, everyone. Really
Good afternoon. Thank you for joining us.
Brill. I think Anna touched on this a little bit, but ours were a bit about sort of NHS staff vaccinations. So the first one we have listed is, should all NHS Northants staff have received the jab by now? If not, sorry, it's written a bit funny. If not, which would not have been invited to have their jab by now? I think it means should they have been expected to have their jabs by now? The second one we have, this doesn't have to be exact, rough figures can be fine. Roughly how many Northants NHS staff are there and how many have received the jab, roughly in a percentage? I know you went through the percentage a bit earlier in terms of vaccinating the general public. And if that's not 100%, is that a big problem, or is it something that you didn't expect it to be 100%? And finally, it's great news about Corby being on the downward flow. As this is happening, which is great, what do you think this is down to? Is it simply a fact of people sticking to the rules and just general compliance for Corby's downward trend? But yeah, that's all my questions. Thank you.
Thank you very much, Tom, for those questions. So I'm going to split those into two speakers. I'm going to start with Anna Dorothy and then come to Simon Weldon. So Anna, over to you first, if I may.
Yeah, sure. Thank you, Tom. Thank you, Councillor. So, so just to reiterate, it's not all NHS staff. It's front-facing, it's frontline facing and supporting staff. So we've absolutely offered that to the vaccine to all of those staff, and as I say, encourage them to take up the opportunity. There's plenty of opportunity for them there to get the vaccine. So we're not at 100%. I haven't got the specific figures for you, Tom, but we're absolutely pushing for 100%. And in terms of the kind of whether that's a problem piece, we're really conscious that it is still a choice, and individuals still have that personal choice. So where we're really focusing our efforts is encouraging, is educating, is answering the questions that any staff might have that's causing them any caution or concern going forward. Yes, thank you.
Thank you very much, Anna. I'll come to Simon Weldon now. Simon, thank you.
Thanks. And just to extend the comments that Anna made, we're not at 100% yet, but we are making sure that we continue to offer opportunities for all front-facing NHS staff to be vaccinated. Staff understandably have huge amounts of questions, and so people like me and my clinical colleagues regularly reach out to them to try and offer any misapprehensions or clear up any misunderstandings people have about getting vaccinated. And just to reassure you, we remain completely committed to increasing our vaccination uptake as fast as we possibly can. The broader picture obviously is, as I said when I spoke, the number of patients in hospital is coming down thanks to our collective efforts in the community. And that's the real marker of the success that we need to remain focused on. Thanks.
Thank you very much, Simon, for that. And then the last bit was about Corby, your question about Corby. And I'm going to come to Tom Beattie on that. Councillor Tom Beattie, good afternoon, sir.
Yeah, good afternoon, Ian. Thank you. And thanks, Tom, for the question. Tom, your written question begins, are Corby's COVID troubles now over? And my answer to that would be, of course not. I don't think the country's COVID troubles are now over, let alone Corby's. But as we've heard from Lucy's report earlier, there has been significant improvement in the figures here in Corby, and that is to be welcomed. And what's that down to is the second part of your question. Was down to a lot of hard work by a lot of people, not least, I think, the residents of Corby, as Lucy pointed out earlier. But there's efforts from our public health colleagues, our environmental health officers at the council, COVID marshals, the police, all of that important communication messaging that we've been getting across, including using these Friday afternoon press conferences to press that message home, has all had an effect. And I think that's where the reasons that we see that downward trend. We still want it to come down further. We want it to come down further, faster. There will always be a minority of people who choose, for whatever reason, to not abide by the regulations, to not follow the guidance. But thankfully, the vast majority of people in Corby are sensible. Our residents have listened to what we've had to say to them and have responded. And as a result, we're now moving in the right direction. So I'm very pleased to be able to see that. Thank you.
Thank you very much, Tom, for that. And thank you for those questions, Tom. They're very detailed as always. Thank you so much. We're going to move on to Alistair Ulk from the Chronicle and Echo. Alistair, hi, good afternoon.
Good afternoon, can you hear us?
Yes, I can hear you, sir.
Sorry, sometimes I have problems. Thank you very much for pulling up my question. Yeah, could I ask, probably Lucy or anyone else who might want to jump in, can you give us an update on how the return to school has gone in your estimation, particularly with testing? I saw that the figures were quite fewer this week. The age groups one was quite down for school children. But if it can give us an update on where you think testing stands in the return to school, has it been more or less than you thought expected? What were the predictions as well? Where do we stand?
Thank you very much, Alistair. I think what I'll do is I'll bring in Paul Andrews, who's from our children's cell at the County Council, to answer that question for you. Paul, good afternoon.
Good afternoon, Councillor Morris. Good afternoon, everyone. Thanks for the question, Alistair. I think the return to school has been brilliant. It's certainly, when I've been out and about in the week, hearing children back and playing and having fun has been amazing, and it's really brought a smile to my face, even when the weather's been terrible and work's been hard. So I think everyone's enjoyed children coming back. I know, having spoken to head teachers, that they've really enjoyed and having children back, and I know from speaking to children and young people that they've really enjoyed being back at school. So I think from that angle, it's been fantastic. I think in terms of data, primary schools, we've had 97% of our pupils back, which is about where we would normally be at any other time of year in any normal year. So I think that's excellent. Obviously in secondary schools, most secondary schools and FE colleges have been phasing the return this week to enable testing. So their attendance has been less, but it's still been very good. Coming on to testing, anecdotally, testing has been going very well. I think perhaps better than we all expected. So certainly I had a conversation with one head teacher who told me that 96% of their pupils had engaged with testing, which I think is absolutely fantastic. That's an incredible amount, and it's testament to the hard work of that school. But I know that the FE colleges who I meet with weekly have been doing an incredible job, and I know the BBC interviewed them on the radio, and they've been doing an incredible job as well. In terms of the figures on testing, we haven't got data for the full week yet, and even when we do get that data, it tends to be about Northamptonshire residents as opposed to related to individual settings, although we do understand which settings the positives have come in, if that makes sense. So the information I can give you at the moment is that between the 8th and the 10th of March, there were 13,319 tests. Of those tests, 7 were positive, which is a rate of about 0.5%. Hopefully that's answered the question.
Sorry, thank you very much, Paul, and thank you, Kevin, for that. Alistair, sorry for that question. A very good one, and we always talk about our schools and the wonderful work that they've been doing across the whole pandemic to keep schools open, and of course to open them at relatively short notice, really, on the 8th, and it's really impressive to see. So thank you to all our schools and head teachers and all the staff there, and also to our staff at NCC, obviously, including Paul in the cell, who have worked extremely hard to make this happen. So thank you for that. I'm going to bring in Kevin Nichols next. Kevin, good afternoon.
Hello, Councillor Morris. It's Alistair again. I think
hello, Alistair again.
I've been called to a breaking thing that he has to jump onto, so it's me again, if that's okay. I'll read his question before him.
Of course, don't worry.
I'll read it verbatim because it's easier that way. Sorry to throw social media rumours at you, but a couple of stories we've carried on COVID fines have been issued. I've met with comments such as, don't pay it, they're all being thrown out in court, they're not being seen in court. This is the police, I suppose. Do you have any indication on how many fines have been paid in Northamptonshire to this point, particularly the £10,000 ones, to prove what the prosecution rate is? And if I could jump straight onto a second question, again for the police. One of the officers this week, I can find them later, tweeted this week that parents can be fined £200 for their children being caught out and in gatherings. What's the guidance on that, and would you endorse that warning?
Thank you very much, Alistair, for those, and I'll bring in Simon. He did probably deal with that first question in quite some detail, but I think it's always good to reinforce the messaging. So I'll come to Simon Blatchley on both those questions. Thank you, Kevin. Over to you, Simon.
Okay, thank you, Councillor. I covered off some of that one. To answer the specific question on £10,000 fines, the ones that we've issued have all been appealed, and those will work through the court process now. The precise numbers of payments, I couldn't tell you. That data is released, I believe, once a month, and when that report is published as to payment, and that can be shared. That's a national report that comes out as to progress as to fines issued, etc. Obviously, with the backlog in the courts at the moment, you'll be aware of, in the broader justice system, that will clearly have an impact on the issues going through courts as well. The second one is accurate. Children cannot be fined for COVID breaches. However, enforcement powers have been given to the police, where a £200 fine can be given to parents. So we would encourage parents to, again, as I was saying earlier, to please follow the guidelines. What we do at the moment is, where we do find gatherings of children, we'll always try and engage and explain. Where possible, we'll take the children home to their parents, have a discussion, and we'll issue a warning letter. To date, we haven't needed to actually issue any £200 fines, because just engaging and explaining seems to have been sufficient. But yes, we do have that power. And yes, at the moment, we would encourage parents to just, again, see us through to the end of the lockdown. Please stay safe, and just please try and control children as much as possible. Thank you.
Thank you very much, Simon, and thank you for those questions, Kevin. I will come now, if I may, to Martin Heath from BBC Radio Northampton, who is covering for Laura Coffey while she's on leave. Hello, Martin. Good afternoon. Welcome.
Good afternoon. I've got 5 questions, actually, which I've submitted. The first relates to faith communities, because we've covered many times the fact that some people from certain faith communities are worried about the vaccine and whether or not it conforms to the rules of their faith. And there's been a lot of work in the county to try and address that, and to try and persuade those people that the vaccines are safe and compliant with their religion. I'm just wondering if there's any way of knowing whether that's been successful, and whether people from those faith communities are now accepting the vaccine. That's the first point. The second is consistency in terms of who is invited for vaccination. Now, this arises from the fact that we've heard anecdotally that some GP surgeries are offering the vaccine to groups that aren't supposed to be a priority. For example, teachers, and they're doing that on the basis that teachers are social care workers, effectively. And I think from the answer we got in our radio interview yesterday, that's not supposed to happen. But I just wonder if any action's actually being taken make sure that vaccination offers are within the policy range. And also whether indeed when vaccinations are offered, there's any assessment of different vulnerabilities. In other words, would a teacher with mild asthma who's surrounded by children all day be offered a vaccine, whereas somebody else with mild asthma who doesn't have that contact not being offered a vaccine? Question 4 was on pharmacies, and as you say, 2 pharmacies are offering vaccines. Is that scheme going to be extended in the county? And finally, plans being put in place to ensure that there is compliance when the guidelines are relaxed to an extent on April the 12th. I mean, for example, are plans being put in place to police pubs and make sure that people are only meeting outside rather than drinking inside? I think that's the 5 questions.
Thank you very much, Martin. Some very good questions there, and we'll run through them in the order that you presented them. So the first one is the question about faith communities and vaccination uptake, which is something we're all very concerned about. And I know everyone is working very hard on making the uptake better. But I'll come to Anna first to give the vaccination viewpoint on that, and also probably bring in Lucy as well, Lucy Whiteman after Anna. So Anna first. Thank you, Anna.
Okay, thank you, Councillor Morris, and thank you for the question. Quite rightly, this is a big area of priority for us. So we are absolutely aware that the uptake of vaccine in some communities and spiritual groups as well is not as high as we would like. So we've got some really focused work going on at the moment to understand some of the reasons, to provide the education and make sure that we're absolutely as accessible as possible as a service for people to access that vaccine. We're also dedicating a public health consultant a couple of days a week going forward to develop a really detailed action plan about how we can focus and increase the uptake across those groups. We know as well it's our BAME communities, our Eastern European communities, and some of our younger people as well. So we need a plan that really encompasses all of those individuals and groups. We get some really good data now that breaks those cohorts down and the individual communities and groups down. So we're able to use that to inform our planning going forward. I don't know if Lucy wants to come in any more on that one before I just move on to the other questions.
No, I'll leave you to it, and I'll come in on the last one if that's all right.
Yes, perfect. So yes, Anna, if you don't mind moving on to the next one. Perfect, thank you.
That's fine. So this was just in terms of who's invited, and just your comment about some GP surgeries offering vaccine to groups who are not supposed to have it. So we're really clear across the county that we're following JCVI guidance, that all of our teams that are vaccinating should be following that guidance. And we'll continue to reinforce that. So teachers are not within that cohort. There's a very small group of teachers who are looking after children with really, really complex health needs. Apart from that, teachers are not being vaccinated as part of current cohorts. So we continue to work with our primary care partners to ensure that guidance is followed, essentially. Onto your query about individuals with particular vulnerabilities, I'd just reinforce the JCVI guidance, actually. So there are, there's some professions that are included within the guidance, such as health and care workers. Teachers are not included in that. And then separately to that, under cohort 6, are those individual conditions that are considered under cohort 6 for prioritisation. So we follow those priorities essentially that are set out. So there isn't that scope really to make individual clinical judgments. It has to be in line with the guidance that's there. Thank you
very much, Anna. And then there was a question about the pharmacies, which was for you as well. And then we'll come to the last question, which was for Lucy. Thank you, Anna.
Okay, so yes, we've opened the 2 pharmacies as the pharmacy vaccination centres as I stated originally, and we're absolutely looking at opportunities to open up more community pharmacy vaccine opportunities, and we're working that through now. So we'll hope to be able to provide you with some updates on that over the next couple of weeks.
Thank you very much, Anna. And then the final question was around plans being put together to ensure that guidelines are adhered to, just as a reminder, because there was quite a few questions there, and I'm going to ask Lucy Whiteman to answer that one. So thank you.
Thank you, Councillor Morris. So yeah, a really good question. And the one thing that obviously a reducing case rate in most areas and a more positive sort of starting point for the next steps affords us to do is be a bit more proactive in this work. So environmental health officers, we've talked about the importance of their role in this. They've been reaching out to businesses that are due to open in the next phase to make sure that obviously their settings remain COVID secure and again need to be adapted as required to the new requirements as and when the detail of that all becomes clear. The joint enforcement team meets on a regular basis. They work between the wardens, the police and the environmental health officers to identify where we think proactively the new sort of hotspots might be. So again, just trying to make sure that we've got additional wardens to be able to go out and ensure that people are educated on the new restrictions and guidelines, keeping a distance, because that's one of the real worries is that people will forget that just because they're allowed to meet outside, they're still required to do so at a distance and as appropriate to actually be wearing their face masks, etc. So all of those things need to obviously be reinforced. And again, this is where Kath and the wider comms team across all the boroughs and districts and the county council comes in. So again, providing all of our businesses and general public spaces with posters that inform and enforce all of those good practices, remind people what the current restrictions are and when each of those changes, and obviously just make sure that again businesses feel supported. I'm sure they're just as pleased as the schools have been to be welcoming people back, but they, they will want to do so in a safe way, and that's just not about what we do with assessing, but also about people who attend those settings remembering to obviously adhere to the rules. So lots of proactive work going on to make sure that we can continue to keep a grip of the current case rates and move through all of the dates as we want to get back to some sense of normality in early summer.
Thank you very much, Lucy, and thank you very much for those questions, Martin. I think we've covered all of those. So we come next to the Global Media Group, and they don't attend, but we read them out for them. So this is to Paul, who is the school's lead. Now, he has probably already answered this question, but we will ask the question again as we like to allow them the chance to hear the answer from Global Media Group. So I'll read it out. How many positive cases have emerged from the lateral flow tests at school this week? And has any pattern yet emerged over location, age, and testing positive? Paul.
Yep. So hi, thanks for the question. We've had between the 8th and the 10th of March for Northamptonshire residents, 13,319 tests conducted, of which 7 were positive, which is about 0.5%. I'm not aware of any patterns over location or age.
Thank you very much, Paul, for that very succinct answer. There is one to Simon next, Simon Blatchley from the police. I'll just read it out. You have probably already answered this, but I think we like to read these out, and if you don't mind answering very briefly again. So with Northampton Police having to issue another 177 fixed penalty notices last weekend, including the Corby football fans, it appears people are clearly taking no notice of the warnings. How does that make officers feel dealing with a part of the population which clearly doesn't care about the dangers? And then there's another question behind after that. So Simon, over to you.
Thank you, Councillor. Again, I've covered some of this off. I think it's fair to say that officers do get frustrated when they do see the clear breaches, as I've described earlier, but I'm probably no more frustrated than the public that do as well. The ones that are law abiding, they are following the rules, they are staying at home, they're not inviting people around their houses, and they're not meeting outside in large gatherings. So I think the frustration is probably equally shared. And the second question about the school. We've obviously increased the patrols, neighbourhood officers, PCSOs, patrolling outside schools at peak times. To date, we've seen overall lots of compliance and no real issues where we've had to carry out any sort of enforcement activity. So it's really positive to see that activity by the schools and the students. Thank you.
Thank you very much. That second question, because I hadn't read it out yet, but you've already answered it, Simon, but I will just quickly read out the question was, so you don't need to answer it again, but it was, how does Northampton Police think the back to school's been? Have youngsters been getting to and from school in a COVID safe way, do they think? And you've answered that one, so thank you. I just wanted to read it out. We've got Kate Cronin next from the Northampton Telegraph. Good afternoon, Kate, welcome.
Afternoon, Councillor Morris. I have two questions. The first one, I guess, will be to Simon Blatchley, and it's about the incident on Sunday in Corby. Have you managed to find the organiser yet and issue your £10,000 fine? And secondly, there was some reports of sectarian chanting, so I'm wondering how you're dealing with those, if you indeed have had a report about those. My second question would be probably to Lucy and Anna. Corby is currently behind all the other areas in Northamptonshire, according to the figures that came out, I think, yesterday, in terms of the number of over 60s that have been vaccinated. I think we're around 80%. Do we know any reasons behind this, and is there a plan to improve the rates?
Thank you very much for those questions. I'll come to Simon first, I think, and then to Anna on the second part. Thank you very much. So Simon first, then Anna. Thank you.
Thank you. Yeah, the Rangers celebrations in Corby were, of course, disappointing, and the numbers that turned up. Excuse me.
I think you're still there, Simon.
I am, sorry. I've tried to turn my phone off. Apologies, Councillor, I'll start again.
Don't worry, I thought you'd frozen there.
No, I just tried to pretend. Just to answer the question again, some tickets were issued on the night, on the day. Disappointing to see that level of gathering there. We have not yet identified the organiser. Investigations are ongoing, and including broader investigation over the range of public order offences that were committed that night. So we do have a number of things to follow up, complaints from the public, things like officers' body-worn video, CCTV, to identify those that were there and the broader offences as well, not just the COVID ones. Thank you.
Thank you very much, Simon. And then I'll come to Anna on the second part of your question, Kate, which was about areas and vaccination levels in Corby. Anna, thank you.
Yes, thank you, Councillor Morris. So we are, we're absolutely committed to getting everybody vaccinated as quickly as possible, and not leave anybody behind. I think there will always be some fluctuations in rates, and we're tuned into those. So we do focus in where we think anyone's at risk of being left behind. I think one of the key reasons for this, though, is that Corby was part of one of the later waves in terms of starting the vaccination programme, and therefore there is always a degree of catch up. So I think that's the main contributor, really. But we remain very focused on that area and making sure we give them the opportunity.
Thank you very much, Anna, and thank you, Kate, for those questions. As referred to earlier, our vaccination numbers are very impressive across the whole county, and we can be very grateful for the teams that are making that happen. So we are getting quite tight on time, so I'm going to try and now come to Ian Kelly from BBC Look East. Ian, good afternoon.
He's not on the call, actually, but I think you've already answered his questions because it was about lateral flow.
Okay, brilliant. So we will skip straight to you, Stuart. It's almost like you've preordained your early arrival for your questions. Good afternoon, Stuart. We will, in which case, we will come to you, sir. Good afternoon.
Good afternoon. My first question has already been asked, but my second question was to perhaps the hospitals or anyone from primary care. I just wondered, it's obviously great news that the number of people in hospital with COVID is falling, but I just wondered what strain long COVID was placing on hospitals and primary care, and what facilities and what treatments are available in the county, either through GP practices or at the hospital for long COVID patients?
Thank you very much for that question. We are joined actually today by Tracy Dempster, who is the Assistant Director of Ambulatory Diabetes and Therapy Services. It's a bit of a mouthful for a Friday afternoon. So I'm going to bring in her, I think, to answer that question on that. And then maybe Simon Weldon may also wish to make some comment. So good afternoon, Tracy. Welcome. You haven't joined us before. Thank you for your time today, as always.
Thank you, Councillor Morris. Yes, I'm the operational lead for the long COVID services in Northamptonshire. So I'll be able to answer the question about the provision for people with long COVID. So we're now seeing a significant number of patients presenting with a range of ongoing and persisting symptoms after COVID infection. Patients typically experience breathlessness, extreme fatigue and memory issues, as well as anxiety and low mood. And in the county, the Health and Care Partnership has worked together to develop a new post-COVID assessment service, and that's hosted by Northamptonshire Healthcare Foundation Trust, the organisation I work for. Patients can be referred by their GP or their hospital doctor to this service if they continue to experience symptoms as a result of COVID infection for 12 weeks or more after their illness. And the service aims to assess patients on a number of domains, understand their rehabilitation goals, and provide or signpost services that will support their recovery. The sorts of things that we're able to offer for patients are access to services such as IAPT, which is Changing Minds, that's access to psychological therapies, is what IAPT means, dietetic, speech and language therapy, among others, and also community voluntary groups such as Breathing Space. And we're in the midst of developing a fatigue management group that will also be offered to those patients. The team providing the service includes senior occupational therapists, physiotherapists, and a GP with an interest in respiratory medicine. And they carry out virtual and face-to-face assessments of patients in their own homes and help them to manage their rehabilitation journey. Thank you.
Thank you very much.
Indication as to how many people that's affecting in the county and the numbers involved?
We would expect anything above 2% of the total number of cases who were affected by COVID to have some degree of long COVID symptoms. It's iterative, really. We're learning about this as we go along, so that might be a bit higher. And at the moment, we have had over 100 referrals to the service.
Thank you very much.
Thank you very much, Stuart. I think long COVID will be with us for quite some time, so I'm sure we'll be hearing a lot more about that as we go. I wanted to bring Simon Weldon in as well to comment on the primary care hospital angle for the long COVID and other issues. Thank you, Simon.
Thank you. The thing I'd add, Stuart, I think, is to draw attention firstly to the fact that we've obviously got to now focus on recovering normal services, and my focus will be, particularly as we go forward, not just on the long COVID patients, but making sure that patients who've had treatment delayed during wave 2 get access to treatment as quickly as we possibly can in the months ahead, because treatment, whenever it's delayed, is distressing for families and distressing for the individuals concerned. So I just wanted to draw attention to the fact that the problem is multifaceted. It's not just about long COVID, it's also about people who have had to wait for treatment that they otherwise wouldn't have had to wait. We have about just over 500 patients who've waited over 52 weeks for treatment, and that clearly is going to be a priority for me as I face the months ahead. So long COVID is important, but I want to encourage people or want people to know that we will be prioritising those long waiters, and also we're encouraging everybody who needs treatment to come forward. Do not delay for treatment if you think you need it, because the NHS is still open for business and we are trying to get us through as many patients as we possibly can.
Thank you very much, Simon. And yes, part of that planning going forward is going to be very interesting. We do have a couple of minutes, so I'm going to allow, there are 2 hands up. I'm going to allow one last question, which is from Peter Rogers at ITV Anglia, because we haven't heard from you before, Peter. So if you could ask a very quick question, we can pass it by the panel. Peter.
Yeah, thank you very much. I appreciate it. My question is just for Assistant Chief Constable Blatchley, which would be, what are the police's message for anyone who would be wanting to travel to a public gathering this weekend, one of the vigils that's taking place in connection with the Sarah Everard case? There are some, none in Northamptonshire, but there are some in sort of Cambridge, Birmingham and Leicester, so people might want to travel to them.
We'd be asking them not to. This has been, you may be aware, this has been some discussion at the National Police Chiefs Council, as well as some guidance that's now come from the Home Secretary, I believe, and the Police Minister, which is by, if it's an organised gathering, it does actually breach COVID regulations. So we'd actually be asking people if they could not travel and try and sort of have a vigil in some other way, rather than gathering in large groups. It's a difficult one. It's a difficult balance for the government to sort of give some direction on as well. But our message would be, please don't travel. Please think of some other ways of marking this vigil, rather than gathering in large groups in an open space. Thank you.
Thank you very much for that question, Peter. And I think we would all agree with that approach that Simon's outlaid there. Don't go and join these groups. Don't go on marches, and don't join any large numbers of people in any open setting. It would be foolhardy, to say the least, I think, at the moment, wouldn't it, Simon? So did you want to add anything, Simon?
I was just going to say, because not only is it the gathering, one of the issues that I think has been picked up by health colleagues is how do people get to and from the event, which quite often can be on cramped public transport vehicles, etc. So it's not just the event itself people need to think about. So it's exactly the message you just passed, Councillor. Thank you.
Thank you very much, Simon, as always. I think I see Alistair has got his hand up from the Chronicle and Echo, but unfortunately, I think we are out of time, Alistair, so I do apologise. But I thought it would be only fair to bring in someone new for a question at the end there. As always, I'm sure you can pass any other questions to us, which we will happily answer, or indeed next week at the press conference. So on that note, I would like to say thank you very much, everyone, for coming today. Some really good questions and some great answers, as always, from our panel, who I know are very busy people. So all it remains for me to do is wish you a good weekend and stay safe, stay home.